Hello everyone, I'm Yahya Wan and I'm working as an occupational psychologist in Nishan Rehab, Islamabad. Nishan Rehab is a rehabilitation center for addiction, depression and different mental disorders, established by Dr. Talat Habib, who is a psychiatrist, who is the founder of Nishan Rehab and also the president of Nishan. Today I'd like to talk about how to gain leverage and become an effective intervener. Let's talk about addiction, because you're here probably because you're facing addiction, or someone you love is affected by addiction, or someone you know is affected by addiction, and you're worried because you don't know what to do. You must have tried multiple methods, multiple times to try and put a stop to that addiction, but you couldn't. So today, the purpose of this topic, how to gain leverage and become an effective intervener on addiction on an addict, will shed some light on how we can effectively put a stop and intervene in the process of addiction. So to stop something, first of all, I believe that we should be able to understand it. And addiction, as described and as told in the medical field, in psychology or in science, addiction is called a disease. It is referred to as a disease. Like every disease, addiction also has its characteristics. There are four main characteristics of addiction. The first characteristic of addiction is that it is a chronic disease. Okay, so you might have heard the word chronic before somewhere, thinking, you might have heard it, right? The word chronic means incurable. Let's take an example. Have you ever heard of diabetes? Have you ever heard of blood pressure? If you have, you must have heard the word chronic as well, because the word chronic is often associated with these common diseases. Why are they called chronic? The word chronic means that they're uncurable. Blood pressure is uncurable, diabetes is uncurable, but the disease can be managed. A chronic disease is a disease which cannot be cured but can be managed effectively. Like diabetes can be managed, blood pressure can be managed. Just like that, addiction is a chronic disease which once you are affected by it, once you're sick and once you're addicted, you cannot completely be cured of that addiction, but you can learn to manage it. The second characteristic of this disease is that it is progressive. A progressive disease is a disease which increases in intensity and worsens over time. It does not stay the same, it does not decrease, but it only goes forward, it only increases. In that way, it's called a progressive disease. Let's take an example. When I got addicted to, for example, if someone got addicted to alcohol, can be anyone, or cannabis, or anything else, they would take an amount, for example, 10 glasses a day, something like that. But after 10 years, they'd be taking 30. Or if someone's doing cannabis or heroin, they'd be taking about 2, 3, 4, 5, 6, let's say 8 cigarettes a day, but after 10 years they'd be taking 20 or 30. So it's a disease which is progressive. It doesn't go back, it only goes forward. The third characteristic of this disease is that it is a primary disease. What is a primary disease? A primary disease is a disease in which it's a disease which is not caused by any other illness or disease, but it's a disease within itself, is not caused by anything else. For example, someone cannot say that I had diarrhea, I had blood pressure, I had schizophrenia, I had ADD, I had ADHD, I had depression, anxiety. They are all illnesses, but they're not the cause of addiction. Addiction is only caused through excessive use of drugs and alcohol. That's why we call it a primary disease. It's a disease which is simply caused by taking drugs, is not the cause of any other disease. And the fourth characteristic of this disease is that it is potentially fatal. What is a potentially fatal disease? A potentially fatal disease is a disease which eventually leads to death. It can be through physical problems, like if you're getting sick, your liver's damaged, you'll have heart problems, brain problems, kidney problems, stomach problems. It could be through mental problems, like damage to the brain. It can be through accidents when you were not in your conscious state of mind and you were taking drugs and an accident happened. Now some people, they really contradict with them. I remember a client once came to me and he's like, I told him it's a potentially fatal disease, and he's like, it's not a potentially fatal disease. I mean it doesn't, because fatal means really bad or harmful. When it gets a potentially fatal, it's he had that. So he's like, if I overdosed on drugs, I would die peacefully in my sleep, right? And so it won't be potentially fatal. I mean, it won't, because the concept that we often get through of potentially fatal is that it's going to be a very hurtful death. No, that's not the case. That can also be possible, but then we discussed the term potentially fatal, and then we finally came to realize that even if someone doesn't die in their sleep due to overdose or anything, but 10 years or 20 years later they're going to have some problem, and it's ultimately going to lead to death. So this addiction is a disease which worsens and will only lead to potentially fatal end, and the only cure is to get treatment for the disease, and that's the only way. We can only learn to manage it, and if it's not managed, if it's not treated, then it will end up being potentially fatal for the addict. Even after knowing so much, again, we are asking ourselves the same question. How has the addict been able to avoid treatment? That's the question we should be asking ourselves. We always ask the question, we're always asking how to get an addict into treatment, but the question that we should be asking ourselves is, how has the addict been able to avoid treatment for so long? Even after facing